eye, kidney, nerve complications. As it goes above, from 7 to 8, 8 to 9, that 1% increases your risk of developing eye, kidney, nerve complication by 25%. So 7 to 8, 25% risk. 8 to 9, 50% risk. 9 to 10, 75% risk. Above 10, 100% risk of developing complication. So any 1% lowering also reduces your risk by 25%. And all we are trying to do is to keep that A1C below 7. That's our entire goal of treatment. We call it as a ABC actually. A is A1C, below 7%. B is blood pressure. You have to keep it at whatever is normal for your age, at least below 140/90, preferably 130/80. C is cholesterol. The bad cholesterol is LDL cholesterol. Should be below 100, below 70 is good, even below 50 is even better. But at least below 100 to start with. For the whole population you want to bring, everybody 50 and all may be difficult. But if it's possible, then you bring that. D is discipline. Diet, exercise, sleeping, this, that, all that. If you follow this A alone, you can prevent eye complication. Nobody will develop diabetic retinopathy. There'll be no blindness due to diabetic. Same thing for kidney. Same thing for nerves. Neuropathy, burning feet and numbness of feet. These three can be eliminated if you just keep that A1C below 7. Nothing more you have to do. Okay? If you want to prevent heart attacks, strokes, gangrene of the feet, then B and C also have to keep. Blood pressure also under control. Cholesterol also under control. D also includes no smoking and all that. Because you smoke, then all gone. So if this A, B, C, D you do, I have been telling year after year on World Diabetes Day, I've been saying, we should have a complications-free India. People ask me, can you have a diabetes-free India? I say it's difficult. It's difficult because age is a non-modifiable risk factor. As you grow older, you'll get little diabetes. Yeah. Okay. Can you completely prevent graying of hair? May or may not. Can you completely prevent balding? It may not be possible. Okay.
True.
But it doesn't matter. If you get little diabetes, as long as you don't suffer, it's okay. So I keep telling people, don't worry about diabetes-free world. We'll worry about a diabetes complications-free world. That is possible. And I want to see it in my lifetime. And for that, I'm saying ABCD. That's it. Get your A1C down, keep your blood pressure down, keep your cholesterol under control, and follow some discipline. Diet, exercise, no smoking, get to sleep on time, take your medicines, go for a checkup. Finished. You may say, is this rhetoric or you have actually done it? I've actually done it. In 2013, we showed 50-year survival of type 2 diabetic patients, 50. Okay, I had about 400 patients who finished 40 years and some who finished 50. Now some have finished 60, 65 years with type 2 diabetes. So the American Diabetes Association gave me the Harold Rifkin Award as the first to show in the world 50-year survival of type 2 diabetic patients. Partly because I was lucky, because their diabetes itself comes only at 50, 60. For them to get 50, 60, they should be all 110 years old.
Yeah.
For us, we get at 20, 30. So to get 50 years survival, when you're 70 years old, you can get 50 years survival. So that way we're a little lucky that people get it at a younger age. So they're able to show 50 years, but nobody had shown it. So they gave me one of the highest awards in the American Diabetes Association as the Harold Rifkin Award. So they gave me that. But the point is not the award. The point is that people can live for 50 years without. Then they said, you only showed 50 years survival. You didn't show people living up to 90, 100. So I said, that's my next project. So we collected people who have finished 90 years, 95 years, 100 years with diabetes. Large series now. 102 years old, diabetic, 50 years, 60 years, nothing. They walk in, they're able to. One guy wrote a book at the age of 97. Okay. One man, when I called all these 90-year-old people for a press conference and to show the world that it's possible, the chief guest was 101 years old. But he was my chief guest.
But tell me, if you said A, keep your AB1C under control, blood pressure under control, cholesterol under control, do diet, exercise, sleep, all of that under control. When all of it is lifestyle management, why do I need a doctor like you?
To tell you that. How do you know all that? You know your blood pressure. You know what cholesterol to do. You know how to bring it down. You know all the glucose. You know, it took me 50 years to learn all that. The lifestyle part is one. The ABC is done by the doctor. The D only you're doing. Okay, the ABC, where to give the medicine, how to lower it, how much to lower. Should I bring the A1C to 7 or to 6 for you? Which is safer for you? Those things I decide, no, based on your condition. Suppose your heart is already little at risk. Now, if I go and push your A1C below, I can produce a heart attack for you. Or I can produce some arrhythmia for you and push you into...
So it's not just lifestyle management.
Lifestyle is important. Beyond that, there's another thing which we showed. Regular checkup is also very important. Okay.
But tell me, if I do regular checkup and I am following discipline, walking every day, sleeping on time, doing weights to building some muscles, eating greens, eating proteins, doing everything that you just suggest.
Yeah.
Do I still need a doctor?
You still need a doctor and still need a checkup. I'll tell you why. Because of your age, things may go wrong. Okay. I'll show. Okay. Now, if you got HbA1c, let's say 7. I want the HbA1c at 7. Okay. Now you have come to me and your HbA1c has come there. This is 2026. I've told you HbA1c is 6.5. Now you're saying, I don't need a doctor now. I've reached 6.5. He told me below 7. I don't need a doctor.
Yeah.
Now, we talked about hedonic. We talked about things slowly changing in the body. There are also biochemical changes occur due to age, due to so many other factors, things can change. Now, my next checkup I'm saying is, before 2027, you come once more to me. After 6 months, I'm telling. But you're saying, no, I won't come. This guy want to make money, is calling me, I'm not coming. What will happen is, it'll go there. No symptoms, asymptomatic disease. And you're saying, I'm fine. Okay.
Because I don't feel
because you don't check HbA1c anyway. You'll be saying some sugar. That's because, I went for a marriage last week. So everything you'll have an excuse also. Then it'll go there. Okay. Then it'll go there. Then it'll go there. And one day you'll say, Doc, it's 10 now. And of course, I don't want to tell you I told you so. But I'll have to tell you I told you so. Because if you'd only come here, I'd have brought it down. Then again you go, again I bring it down, again I bring it down. So always your HbA1c is okay. Otherwise going up, 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 up. This happens also with people who try reversal things,
And what happens if I go above?
Yeah, because every 1% I'm telling you that your risk of developing eye, kidney, nerve complication from 7 to 8 when it has gone, already it is 25% extra risk. It's gone to 9, it is 50%. It's gone to 10, it is 75%. It's gone above 10, it's 100%. You're now going at 100% risk of developing kidney. Next time you come here, I'll check your kidney and say, gosh, you started leaking protein. Finished. Sometimes it's not reversible after that. Then what I'll be trying to do is how to prevent dialysis for you. That'll be my next aim. Not to bring all this down. My next aim is how long can I push him without him undergoing dialysis or transplant? Because once a creatinine goes to a certain point, there are only 2 things. Either dialysis or transplantation or death. Finished. There are only 3 things that are possible. If you don't do these 2, you'll die. And how many transplants can you do in India? There are 101 million people with diabetes. Assuming 20% will develop complications. 80% will not. 20%. 20 million people. 20 million kidneys. You're doing 10,000 transplants in a year. Whatever transplant you do, it's only 10,000 in India. 20 million. Where are you going to do? So you have to prevent. To prevent, it's ABCD. For that you have to come. Only if you come, only we'll bring this A and only A has come now. B, C also I'll take care when you come. A also I'll check, B also I'll check, C also I'll check. Then I'll talk to you about D. I'll further reinforce, saying, hey, this one, okay, now next 6 months, let's be a little more careful. I've motivated you. I'll give you an example. Okay, how this works. From the other side,
Okay.
I know you're the doctor and I'm sitting on this side. When I got married,